malaria is still persistent in our society. Proper and early diagnosis of malaria is always a challenge in front of doctors. The technologies are now improving day by day, as previously we depended upon blood smear observations through microscope for the parasites, while today kits are developed which can help in easy and early diagnosis. Various test kits are available to detect antigens derived from malaria parasites. Such immunologic, that is, immunochromatographic tests most often use a dipstick or cassette format and provide results in 2 to 15 minutes. These rapid diagnostic tests, or RDTs, offer a useful alternative to microscopy in situations where reliable microscopic diagnosis is not available. Malaria RDTs are currently used in some clinical settings and programs. However, before malaria RDTs can be widely adopted, several issues remain to be addressed, including improving their accuracy, lowering their cost, and ensuring their adequate performance under adverse field conditions. The World Health Organization is conducting comparative performance evaluations of many of the RDTs which are commercially available worldwide based on a panel of parasites derived from a global network of collection sites.
We came with an innovative technology which will give the diagnosis at resource limited field based level only. Generally, the developing countries or the resource limited areas where the lab atmosphere is not there. For those people, especially the India-like environment where the lab is not available everywhere, the developed kit, the point of care kit that we developed is very useful for the proper diagnosis of patients at field level.
Genomics Malaria PF-PV Antigen Rapid Detection Test Kit is a lateral flow assay-based qualitative determination of Malaria Plasmodium falciparum specific histidine-rich protein 2 PFHRP2 and Malaria Plasmodium vivax specific lactate dehydrogenase PLDH proteins in human whole blood specimens.
If the sample is showing the band at 1 and 2, both the positions, then the sample is positive for Plasmodium vivax and Plasmodium falciparum. So by using a single kit, we can detect both the infections of malaria, that is Plasmodium falciparum and Plasmodium vivax.
These kits have been validated by WHO, FIND, CDC.
This project was completely funded and supported by Department of Biotechnology, Government of India under the BIRAC program. This is completely non-profit organization. The BIRAC is completely the non-profit organization under Department of Biotechnology, Ministry of Health Sciences, Government of India. And we are conducting this program just to bring the awareness on the point of care diagnostics and for the patient health care. There is no profit involved in making the program.